So once you're done with placement of the rubber dam, you can also add the rubber dam napkin to help further dry the area of the cheeks and the skin of the patient, and also it will help and prevent the seepage of any water from your procedure onto the patient's skin. The rubber dam napkin is usually placed on the patient's skin, and then the rubber dam is stretched over it. This way, what is going to be in contact with the patient's skin is the napkin, and then I'm going to go ahead and further retract the rubber dam on top of the napkin and place my rubber dam frame. Respect all the corners. Whatever belongs to the lower right side will be pulled in the lower right side, and then opposite on the left side, and then the upper. Use a Young's frame, that is the metal frame that we have here. There is also another frame, the plastic frame. We call it an Nygaard Opsy. What we have here in the lab is a Young's frame. It's a metal frame. We use these prongs to engage the rubber dam pieces. We go ahead and pull. We try to pull as much as we want because we don't want a crumbled rubber dam in place. It will hinder the working process. We go ahead and pull all the corners. Make sure all the rubber dam is engaged with the prongs. Make sure the dental floss that is tying the clamp is outside and it's free to be pulled at any time in case of emergency. Engage all the rubber dam pieces. And this is how it's going to look like. Rubber dam is stretched and it's ready. Rubber dam napkin is in contact of the patient's face. This is how it's going to be. If you feel like you have too much rubber dam going towards the patient's nose and it's bothering them, you can always go ahead, get a scissors, protect the patient's skin, and cut a piece of rubber dam in order to release the area that is closer to the patient's nose and give them more room to breathe. This is not the case in my patient, but I just wanted to demonstrate that if you have too much rubber dam coming to the nose, that you can always cut a piece of rubber dam. If the patient is not feeling well, or they cannot breathe well, or they're asthmatic, you can also open an opening here, place the suction inside, and try to help the breathing process. Now, how about when we're done and we want to remove the rubber dam? We will start by placing our finger under the rubber dam. We pull and then we cut the septa. What is the septa? It's the area between the teeth, if you can see. The area that goes in between the contacts. I put my finger under it to protect the soft tissue. I cut the septa one by one.